disclosures. And everyone knows that nowadays the causes of maculopathy are several, and we have to extract the more information we have and select the best ancillary tests in order not to miss, in this case, optic disc maculopathy. Everyone knows that almost more than 6 million injections have been performed around the world, but the treatment nowadays should be customized in order to see the whole picture. Let me start by this example. This patient had been injected 6 times because they thought they had CNV. But if you get a long scan after referral, this was treated by general ophthalmologist. If you get a long scan, you can see very clearly that this patient had an optic disbead. And we lost, in this case, more than 6 months for a proper treatment, which is surgery. We have the pleasure to have this paper accepted in Retinal journal, so you got to go into details online. And the purpose of the study is very clearly is to check the features on the OCT in those patients who were misdiagnosed at the beginning and patients who were correctly diagnosed at the beginning, and check if there was any statistically significant difference between them. As you can see on the screen, we have 59 eyes from different 59 patients. And the first treatment they received before referral was anti-VEGF injections. The causes was, of course, CNV, myopic CNV, idiopathic CNV, but optic disbead was not that common. Interestingly, when you see baseline characteristics and results, we can see that there was a statistically significant, it was age. That is to say that general ophthalmologists and some retina specialists don't see that optic disbead can be seen in elderly patients. Another feature on the OCT that was again statistically significant was the outer layer retinoschisis. Interestingly, the optic disbead connectivity was not statistically significant. That is to say that those patients that were treated with anti-VEGF from the beginning, they do have, or they did have, the connectivity. They should have asked for a long OCT, the OCT scan. But the long scan, and by long scan we mean 9,000 microns that goes through the optic nerve from the bottom to the top, is not enough. We had to get 20 dense scans, 60 micron between them, because on the top you can see that the bead is missing, but if you go through and the scan progresses, you can see the connectivity very clearly. But let me tell 2 examples from the paper. If you see this small picture, 2 different cases, you are not going to think in optic disbead in this 80 years old female. But if you get the same patient but with the proper scan, you can see very clearly that this patient had an optic disbead. You can see not only subretinal fluid, you can see also the features we described, inner retinoschisis, and of course outer retinoschisis, and last but not least connectivity. If you go through the optic pit nerve, it's very clearly to see subretinal fluid, but if you go and look into details on a correct scan, you can see this, which is connectivity, and in our 59 patients was present almost in all of them. But let me show you one nice video from patients who were misdiagnosed from the beginning. Again, if you get the long scan, these elderly patients, even with in 1882 described the first cause of optic disbead in an elderly woman. We don't think in elderly patients with optic disbead, but this was not the case, and we have to be aware of this condition, even in patients older than 65 years old. So this is the hot take-home message. Optic disbead can be seen in elderly patients. Long horizontal OCT scan is mandatory in order to not to avoid this condition, and of course early treatment ended up in better results. I don't want to finish this presentation without thanking Professor Lowenstein, our mentor. Without her this would not have been possible. Dean Astor, Javier Melamud, who is the head of emergency room at the University of Buenos Aires, from the International Retina Group, Caterina Bush, Malio Cada, Adrian Fum, Pierre Gabriel, Sasser Sefit, Alessandro Inversini. Our standings are physicians, Sherry Narowski, Sofia Michalewska, Lucas Donato, Adi Barak, Michaela Gostein. So, to finish this paper, we have to take time, get the whole picture in order not to miss the optic disbead in elderly patients. Thank you very much for your attention.